This is Dr. Corey Maas, and I'm glad to be here talking about looking your best, but more importantly, about staying safe and staying healthy at your best, especially at this time with the virus that is a very common type of virus. I think everybody's learning more about viruses than they ever wanted to, unless they went to medical school. But this virus's history is in particular important to me, and how we've managed it is important because it's been a significant impact for our entire economy and society, as well as even how we practice. In the initial 3 weeks of the virus, they asked us to step back and not interrupt the supply chain. So the shelter in place, which we've all heard this term now, allowed or actually asked all of us mandatorily to stay at home as much as we could, with some exceptions for essential personnel like doctors and other workers. At the same time, they asked us to close our surgery centers for non-emergency surgery because we could interrupt the supply chain. That 3-week period was critical for hospitals across the country to get the supplies and the ventilators and the things that they need. And we obviously were all more than happy to make sure that there was no interruption in the supply chain for hospitals that might experience what we all know as surges. And everybody's probably learned more about viruses than they ever wanted to learn in the last 4 weeks. But it's obviously, for doctors, been an area of interest for us for most of our lives. The important thing to know about viruses, especially contagious viruses, is that there are two really severe varieties that can come out, and that's contagion and then how virulent or how nasty the virus is. And on those extreme ends, the Ebola virus that people might have heard of before, which, by the way, viruses are named from where they come from. I don't really understand this whole diatribe about China being prejudiced or racist. The Ebola virus is a river in Africa. The Zika virus is also one. There was the MERS virus, the Middle Eastern respiratory virus. So the viruses are just named from where they come from, and that's the way it's always been. It's not some kind of a racial thing. The China virus might be more appropriately called the Wuhan virus, frankly, to be more specific. But it certainly has no racial implications for those who want to make it that way. It's just uninformed or lack of knowledge if they think that. And it certainly has nothing to do with Asian Americans, which are a big part of our society here in San Francisco. The important part about these viruses, virulence and then contagion, how easily they spread, because there are viruses that we know about and deal with every year, cold virus, rhinoviruses, and some of them are actually coronaviruses. And then there's viruses like Ebola, which is quite severe and has a 90% plus mortality rate associated with it. And those viruses require villages, isolation. They're primarily African origins. Because they're of the severe mortality rates. With viruses like this coronavirus, where the mortality rate appears to be very similar to what it is for the flu, slightly greater probably because it's the first path through our country, through our population, it's a different story. And so preparing for that is really important when you have a very narrow group of people that it primarily affects. And the data shows now that obesity is coming out really on top of diabetes and hypertension, or probably will evolve to that, along with age as predisposing risk factors. So obesity, diabetes, hypertension are big factors, and chronic lung disease. But what they've done is grouped smokers into chronic lung disease, and smoking, from the Wuhan data, which some of the Wuhan data was good, some of it wasn't. So I think some of that was good, showed that in Wuhan, 50% of male patients, especially the younger ones, smoked, versus only 5% of the population in Wuhan of females were smokers. And at a 2.5 to 1 ratio, males predominantly had the severe respiratory portion of or expression of this illness, which ultimately resulted in many deaths. So it's pretty clear, in other words, 2.5 times more men died than women died in Wuhan, which is not true anywhere else where that smoking disparity is so large. So people should know that smoking is anything is a major risk factor, which includes marijuana. There's marijuana's other ways of administering or taking it. So I would strongly advise people who smoke anything to stop smoking. And the reason I get to this is shelter in place doesn't really get us ahead with the virus. Shelter in place, unfortunately, keeps us from being exposed, which keeps it from spreading. But this virus, without a vaccine, is not going to stop until it goes through our entire population. So what we've done is lengthen the fuse, but the bomb is still there. And when we return to society, we're all going to get exposed. Most of us will have very few symptoms. And there's very little evidence of completely asymptomatic spread, by the way. I want to make that clear too. There are familial clusters that have been looked at. And now that we're all aware that any of the symptoms that have been discussed, 85 to 90% or 99% of patients have fever, 80% or greater of patients have a cough or shortness of breath, and sore throat and headache are also in there, but much lower numbers. And if you have any of those, and this no runny nose that's associated with colds and typically the flu, or very little of that. So if you have any of those, you really should be self-quarantining. That's what they're telling people, with the fever being the biggest one because it can be quite high. And then if you get very short of breath, they're asking you to go to the hospital and get tested. We'll soon be at the point where we can get everybody tested, but in the meantime, as we move from shelter everyone in place, we will do what Sweden and England and New Zealand are doing, and that's sheltering the sick or quarantining the sick in place. So it's been a good practice run for everybody to be sheltered in place, but it's much more serious if you have the disease that you have to stay at home. So I wanted to talk a little bit about that and let people know that there's a lot of misunderstanding, even amongst very intelligent people that I've spoken with. We are not going to extinguish the virus by sheltering everyone in place. We're going to extinguish the virus until we have the vaccine by letting it wash through the population, keeping our at-risk in sheltered in place, and making sure that if you're sick, at all sick in this case, you can't leave your house because you will be putting everyone you know and care about at risk. There's a whole nother discussion which our public health officers need to do a better job of as they educate the public about sheltering the sick in place. And that is making sure that people know what they do if they're at home with someone that's sick. And that may mean for a healthy young family that doesn't have any risk factors that they just wish to get exposed and do it together. And that's totally legitimate, understanding that the virus only rarely in those patients gets to, unless they have risk factors, gets to be anything serious. It's a risk either way, but if you're sheltering at home in place, it's very, very difficult to not touch or be exposed to somebody and then take it outside of your own home. It's one of the reasons that the PHOs have been hesitant to get out of shelter everyone in place, which is not a good strategy for mitigating a virus. We want the population to get antibodies. It looks like 4% or something like that in California already have antibodies. So it's affected over 1 million people here, infected 1.5 million people probably in California already. So I wanted to take too long, but I did want to give you my perspective. I'll share some studies with you as they come along, and I shared one about the smoking. We also know I shared the data about risk factors and symptoms. Symptoms are really, really going to be important as we move forward, as we go to the right strategy, the way we've historically always treated epidemic contagions, and that is to shelter or quarantine the sick in place and the exposed. If you have exposure to someone sick, you need to quarantine yourself also, as well as those who are at risk. This is Dr. Corey Maas. I hope you are staying well and feeling your best, and so I can quickly get you looking your best.